respiratory and digestive. Oops. Hello. And it's not week 8, it's week 5. My apologies. And we're going to talk about the respiratory system and the digestive system. So let me fix this. See, I have the power. No, I didn't want that power. Okay. And digestive. See, we all make mistakes. It's learning from those mistakes that makes it all worthwhile. And that's the truth. Okay. So this week, we're going to talk about both the respiratory and the digestive systems. So breathe in, take a deep breath. That's inspiration. When you breathe in, it's known as inspiration. When you breathe out, it's known as expiration. Okay? And look at how complicated your respiratory system is. It's really not that complicated. It starts with your nose and then comes down the back of your throat and then is aided and abetted by your mouth, because some people breathe in through their mouth, breathe out through their mouth. Okay. And then it goes down the pharynx and then the epiglottis. The epiglottis is this little flap that sits on top of the trachea, and that is your windpipe. That's where the air comes in and goes down into your lungs, right? And if you notice, if you happen to know any people who, a lot of times the elderly, the epiglottis tends to not do such a good job as it gets older. Like a lot of us. Okay, so what happens is it doesn't cover. See, the epiglottis is supposed to seal the trachea when you're eating and drinking. So that way the food and the liquid bypass, don't go in the trachea, and they go down into your stomach, right? Okay, however, when you are breathing, the epiglottis flap comes up to allow the air to go down the trachea into the bronchial tubes, into the bronchi, and fill your lungs with oxygen. Okay.
I'm sorry. Say that one more time with the epiglottis.
Okay. The epiglottis is this little flap that sits on the top of the trachea. And when you're eating and drinking, the epiglottis seals the trachea so that the food and the drink can go past into the esophagus down into your stomach. And when you're breathing, the epiglottis opens up so the oxygen can come down the trachea into your bronchi, into the bronchial tubes, okay? And if you've ever had somebody swallow, you call it swallow wrong. So where maybe you're drinking something and it goes into your lungs instead of into your stomach, and you cough because that's not where that's supposed to go. That can mean that the epiglottis is not doing its job properly and it's not sealing that off. Okay. So if somebody chokes, you should say to them, "Excuse me, is your epiglottis not working well today?" And then they will look at you like you're crazy and they say, "Go away, kid, you bother me." No, I'm kidding. Okay. So the oxygen goes down, the epiglottis flap opens, the oxygen, as you breathe in, goes down the trachea into the bronchial tubes, into the bronchi, which are those little, and if you look at it, it looks like the bronchi looks like an upside down tree, right? So you see the trachea is the stem of the tree, and then the right and left bronchi are like the branches of the tree, and then you have all of these little little twigs and blossoms. And then the oxygen comes down into your lungs, and then is exchanged at the pulmonary art and the pulmonary vein. It is exchanged for the bad stuff that the veins are bringing, the waste from the cells, and then that is expelled when you breathe out. You breathe in good oxygen that goes into the pulmonary vein, which continues onto your heart, and the pulmonary artery gives you the, no, I think I got that confused. I'm sorry. Look it up. All right. I haven't had my coffee yet today. All right. So here, just to review, now you can see this close up. Your upper respiratory system starts here in your nose. And of course, you have your sinuses. If you've ever had a sinus infection, you know how painful that is. And that's why what happens when you have that infection is your nasal mucosa swell up, and that's why it's hard to breathe. Okay, but your upper respiratory system begins at your nose and ends at your pharynx, which is in your throat. Then your lower respiratory system starts at the larynx, which is right below the pharynx, and goes into down the trachea, into the bronchi, into the lungs, the bronchioles, and the alveoli. Does that make sense? Am I talking too fast? Okay,
No,
I'll take.
you good.
No. Okay. All right. So what you need to know about the respiratory system is that any point from the nose all the way to the alveoli can become infected. And as we talked about the epiglottis, if that is infected, that can interfere with a patient's ability to swallow without choking. Okay. Laryngitis is the inflammation of the larynx. And remember, you're learning this in medical terminology. The larynx is a body part, an anatomical site, and you put itis at the end, and that says that's the suffix for inflammation, laryngitis. Okay. Laryngotracheitis is inflammation of the larynx, the trachea, and this whole part. And I got to tell you, when I had COVID back in January, it felt like this was on fire, like I was breathing in fire. I could not believe it. Nasopharyngitis would be upper respiratory infection, the nose all the way to the pharynx. Pharyngitis is inflammation of the pharynx. And rhinitis is inflammation of the nasal mucosa. Okay, so basically what do we have here? We have inflammation. The suffix itis is attached to the organ or the anatomical site that is inflamed. And that's what you see repeated here over and over again. Okay, now, of course, when the baby is in utero, things can happen. And a congenital anomaly means something may not develop properly. Respiratory distress, difficulty breathing. Cyanosis, cyan is the color blue, and osis means the condition of, and that's when you will see somebody's skin can actually turn blue, and that is because the processing of oxygen is not being done properly. And this means that there is something wrong with the way the lungs of the infant is working. Okay. The most common congenital respiratory disorder is pulmonary hypoplasia. Hypo meaning below, plasia meaning situation. And that's where the lung does not form completely or forms improperly. Now, again, these are things that you will learn more about in your experiences. But remember that at this point, you want to have a general idea of what causes what. So as you're reading physician documentation, you're getting involved in the whole process of healthcare. You want to make sure that things are being logical, that they're being done according to the standard of care, because you are part of the team. And whether you are the physician, the nurse, or the medical records coding expert, it doesn't matter. We all work together to make sure the patient is being cared for properly. Okay. All right. Lifestyle behaviors, which you're probably familiar with, that can get that can cause respiratory disorders: smoking, cigars, and cigarettes. Okay. I know you've heard this 1,000 times. Cigars more often cause mouth cancer, as does chewing tobacco, and smoking cigarettes causes lung cancer. It's a fact. And that's, I don't know why, smoke at your own risk. Okay. In addition, sedentary lifestyles, that means sitting around all the time, not having motion, not being active. Okay. And we're not talking about being in the Olympics. We're talking about just getting up and walking around a little bit. What can happen, and you may have heard this happen on long airplane flights, is a deep vein thrombosis. And that is a thrombi is a blood clot that attaches on the inside of a vein or an artery. Okay. And that will interfere with the flow of blood and therefore oxygen to the legs. Bad. But then what's worse is if the thrombus, which is that attached blood clot, detaches from the wall of the vein or the artery and it starts to travel through, it becomes an embolus. So an embolus is a detached thrombus. And what happens is it travels through the pulmonary artery into the lungs, and it can become a pulmonary embolus. And now we are talking about blocking blood flow and oxygen flow, and it can cause death or extreme pain. So this is very important that even if you're not like running marathons, which I definitely don't do, or anything like that, you want to make sure that you are moving around and keep your legs elevated. What?
Rhombus mean the clot, right?
A thrombus, THROMBUS, is a blood clot that's attached to the wall of the vein or artery.
Okay.
Okay. An embolus, EMBOLUS, is a free-flowing blood clot that can get caught anywhere along the trip. Okay. All right. Of course, trauma can cause problems with the respiratory system. A broken nose or something else that can interfere with the patient's ability to breathe. Traumatic pneumothorax. And if you watch any of the TV shows, either the police or the medical, like Chicago Med or Chicago Fire or Chicago PD. Anyway, pneumo, as you are learning, pneumo means lungs. It refers to the lungs. Thorax is part of your trunk. Okay. Now, a pneumothorax means air has gotten into the the area between the lungs and the chest cavity. Okay. This can interfere with the lungs expanding. It can be a penetrating chest wound, which means the air is coming through a hole in your chest and not processing properly. Okay, as you can see here, during a pneumothorax, air accumulates between the parietal and visceral pleurae. Those are the linings around your lungs. Okay, so as I was saying, what happens is air gets in between the lungs and the chest wall, and that causes the lungs can't expand to take in air like it needs to. So the lungs cannot expand properly. Oxygen cannot be brought down into the lungs far enough. And what happens is there's difficulty in exchanging that carbon dioxide with the oxygen. And this will dramatically harm the patient, because you know that every cell in your body needs oxygen to function. Okay, the environment can interfere with breathing and cause respiratory problems. Volcanic dust from an erupting volcano. They just had a volcano erupt. Where was that? Mexico. There was one in Hawaii not too long ago. So this is not, you know, something from thousands of years ago. Man-made elements such as asbestos in the ceiling. You probably heard about that. And you all may not be old enough to remember that there was an outbreak of Legionnaire's disease that was transmitted through a hotel air conditioning system, which is why it's called Legionnaire's disease, because it affected an American Legion convention that was in that hotel at the time. Okay. Another good reason to wear your mask. All right. Okay, any questions about the respiratory system? And remember, all of this time that we spend together once a week here is to reinforce and to supplement what you're already reading in the chapters, okay? Everybody learns a different way. Some people learn by listening, some people learn by reading, some people learn more from pictures than words. I say all of the above. We'll give you everything and you find a way to get it into your brain. Okay? All right. Now, interestingly, just as we said, the respiratory system starts in your nose and includes your mouth. The digestive system starts in your mouth. So if you're drinking and you start to laugh and milk comes out of your nose, that's not part of the digestive process. Okay, that was supposed to be funny. All right, oh well. All right, so the digestive system goes from your mouth all the way to your anus. And the main part, or the straight line between the mouth and the anus, is also known as the alimentary canal. But then you also have accessory organs, the pancreas, the liver, and the gallbladder. We're going to discuss that in a minute. Okay, so the alimentary canal, the main part of your digestive system, starts in your mouth, goes down your pharynx, your esophagus this time. Instead of the trachea goes to the lungs, the esophagus goes to the stomach, and they're here right next to each other. Okay, small intestine, large intestine, rectum, and anus. And that's the way the food goes. Now, the health of one's mouth is very, very important to the health of your own body. So those of you who may not like to go to the dentist, you need to brush your teeth every day, twice a day, to keep the bacteria out, because bacteria and gum disease gets into your bloodstream. Remember, it's all connected. And the reason why your gums are pink is that's oxygen. Okay. And so the bacteria from your mouth can get into your bloodstream, and it has been proven to cause heart disease. I know. You don't brush your teeth and your heart goes funky. Okay. So this is all very, very important to remember, that even though, and I don't know why, but the dentist just seems like such a outlier to the whole healthcare system, but it's not. It's really, really important. Okay. And then we get to your stomach. We come down the esophagus. Look at that stomach. It's such a weird shape, don't you think? Uh-huh. But what it does is the muscles and the nerves massage, and there are nutrients in your stomach that will actually digest your food, and then it will continue on to your duodenum, and that begins the access into your small intestine. Now you have a small intestine, which actually is the pink part in the center of this picture. I know that's hard because they're both kind of pink, but this is pinkier in the center. Kind of looks like a sausage, a really long sausage, right? Whereas the large intestine, which starts at the appendix, includes the cecum and the ascending colon, the transverse colon going across, the descending colon, the sigmoid colon, the rectum, and the anal canal. That's all part of the large intestine. So there are a lot of people that will refer to this as the colon. Then that's not technically correct. But as you can see, just like the rest of the body, there's like 4,000 pieces parts here. Okay. And so the large intestine is the part with the bubbles on the side. Okay. I know. All right. Now, in addition, remember I talked about the alimentary canal that goes from your mouth straight to your anus. So your mouth, your esophagus, your stomach, your small intestine, your large intestine, and out the back door. Okay. But in addition, part of the digestive system includes these 3 accessory organs: the liver, the gallbladder, and the pancreas. And they help within the digestive process. Okay, so that's a lot of real estate that we covered in the body in just a short amount of time. But remember, review often. Review, review, review. That repetition is really what is going to get it in your head and help you make sense. Use a medical dictionary. I strongly suggest, as I said in week 1, I strongly suggest you get that paper dictionary, medical dictionary. Amazon has one for $6. Okay. And the reason why I say paper is because when you're reading, when you're studying, if you come to a word that you don't know, or I know exactly what that means. Anything less than that, I want you to stop and look it up in the dictionary. And here's what I do. I do this, and I've been doing this for decades. Okay. I have 5 medical dictionaries within arm's reach of my desk. And what I do is, if I get a word and I'm not sure, I think I know what it means, but I'm not 100% sure, I will look it up, because I don't ever want to tell a student the wrong information based on my memory. Your memory is not accurate. The dictionary is. So I'll look it up. If I was right in what I thought, I go, yay, I do a little happy dance. Okay. If I was wrong, now I know what the accurate definition is, and I go, phew, I didn't say something that was wrong, either to a colleague or to a student, and make myself look stupid. So instead, I use my medical dictionary and I make myself look smart. Huh? And if there's anything you're unsure of, anything you're not positive, you understand. And that's the point. It's understanding. It's making sense in your head. Query me. Send me an email. I can email you back and you can print out the answer, and that will be a good study guide. Or we can set up an appointment to talk on the phone, or we can do a one-on-one Zoom or FaceTime, whatever is comfortable for you. Okay. But what I want is for you to get a firm, solid foundation in medical terminology that will continue to increase as you go through the rest of your courses. Okay. Any questions?
Is this a right, is this a medical
Oh,
terminology?
Tabor's is good. That's a very good medical terminology. That's a very good medical dictionary. Honestly, I find the definitions a little challenging to understand sometimes. And that's the most important thing about a dictionary is you want to make sure that it's explaining the meaning of the word to you in a way that you understand. We don't want hoity-toity, fancy schmancy. We want, oh, okay, now I understand. Okay.
Right.
So if you're comfortable with Tabor's is an excellent choice. Absolutely. That's good. Okay. Anything else?
That's it. Is I'm the only one on here?
You're the only one on here, but we get a lot of people looking at the recording. Last week we have 49 people. We don't even have oh yes, we have 70 people in this class. So yeah, they listen to the recording because they can't make it for whatever reason. But I'm happy you're here, and I'm happy you all are here listening to the recording. And I want you all to have a great week. Stay safe, be well, and know I'm right here for you, ready to help you in any way I can. Okay? Okay.